Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have none other than plastic surgeon Dr. Joseph Mealy, and we're talking about different procedures today. First up, tummy tuck, followed by breast aug revision, then gynecomastia, and finally otoplasty. And I've known you for a long time, so now I know all the words.
You can say them 10 times fast.
I can say them 10 times fast. Remember, before we get started, any advice we give you today, consult your physician first. All right, let's jump right in. Dr. Mealy, thank you for joining us today.
Nice to be here.
And we're going to talk about tummy tuck. Now, apparently these are pretty darn popular. What is a tummy tuck?
They're very popular.
Yes,
Probably the most
right.
common reasons we're doing them are after pregnancy or after weight loss.
Okay,
Because
right.
what happens is the belly stretches, so we get extra skin. Sometimes the muscles loosen up. And unfortunately, the lower part of our belly is where we like to put fat.
Yeah.
So all three of those can be treated with the tummy tuck. We can get rid of that extra fat, tighten the skin, and tighten the muscle.
You can tighten the skin and tighten the muscle, but are there times when somebody doesn't need the muscles tightened? So can you do a little tummy tuck?
There are times when we do mini tummy tucks where just the lower part of the belly needs to be tightened up.
All right.
But usually after pregnancy, the muscles get stretched out. So usually we're tightening the muscles in those cases. I also do tummy tucks for men. For men, not always do we need to tighten that up. It's just when it's loose. What happens is it lets the guts fall forwards, and then the muscle, by tightening up, is like putting a corset on inside, so it gets the foundation nice and flat, and then everything we do on the outside looks better.
I like that. Let's go to the before and after pictures, because everybody likes those. First picture. All right, what do we have here?
So this is someone who came in after pregnancy, extra skin. So you can see it's kind of redundant, folding over itself, and some fat.
So that was just pregnancy?
Usually pregnancy will do that, yeah, unfortunately. Sometimes no, which is great. And you can see there's some fullness even above the belly button. It kind of sticks out there too. And that's because the muscle has a little diastasis. There's a little separation between the two sides of that rectus muscle that holds everything up. Afterwards, you can see everything's nice and straight up and down.
Yeah, it looks beautiful.
So inside, we've done that corset repair of the muscle.
Okay.
I pull the skin down, sort of like the shade on the window. Sort of loosen it all up, pull it down, and then remove whatever's extra and close it back up. So there's an incision down low at the belt line and one around the belly button.
Now, I got an email. We're going to go to the next picture, too. But I got an email from Kathy from Oakland, and she says, what is the recovery time for a tummy tuck?
Sure. Recovery is a little variable. I would say most patients are still having someone drive them that first week.
Yes.
By the second week appointment, they're driving themselves, feeling better.
Okay, so not too bad.
It's like doing a lot of sit-ups. So it's muscle sore, achiness. The first couple of days, patients aren't always my best friend.
Right.
But by the end of the week, I'm forgiven, and
they
things
love
are
you
looking
after.
better.
All right, picture number 2. This is a beautiful outcome.
So this is someone who had a tummy tuck, but also had the mommy makeover.
Oh, okay.
So the belly's been tightened, but the breasts have also been enlarged with implants and lifted.
I love that. That's a beautiful after.
Thank you.
And not much tummy to tuck on that one.
No, she had some loose skin. It's a little harder to see in the picture. You can kind of feel, if you pinch there, it was more than an inch. But afterwards, it's nice and tight.
And where are the scars?
So the scars are low, so in the belt line and around the belly button. You get to keep your own belly button with a tummy tuck for most cases.
You do?
So usually its neighbors change because we pulled everything down, but the belly button still stays attached.
But you have to make a new belly button hole type of thing?
Exactly. You just make a hole and bring it back through.
Sometimes that doesn't happen, and it's a weird look. Like, they had some celebrities out on the surf, and they don't have a belly button. It's a little strange.
It's better with a belly button. Most people
remember to get your belly button. All right, third picture.
So this one done another little twist. So again, we did the tummy tuck. You can kind of see the shadowing is reduced. The belly's not pushing forwards as much.
Yes.
But she also kind of lost her butt.
She did.
So what I've done is liposuction, remove some from the lower back, the sides, to give it more of an hourglass waist, and then put the fat that we would normally throw out into the butt.
All right,
so it's a fat transplant.
Is that called a Brazilian butt lift?
It is called a Brazilian butt
lift. So you
lift.
can do a tummy tuck and a Brazilian butt lift together?
We can. Now the downside to that is both sides are sore.
Oh, okay.
So you're stuck kind of laying on one side or the other rather than your stomach or your back.
But
so it does make recovery a little bit harder, but it's doable.
You've got a nice little shape afterwards.
Because that fat would normally be thrown out. It's not like we can store it and put it in later.
So you can pop it in the
use it while it's
booty
fresh.
and have a nice, all right. Let's look at picture number 4.
So again, another tummy tuck with, again, extra muscle, sort of laxity of the muscle, extra
That is
skin.
a big difference there.
And this is someone, if they lost weight, they would certainly look better, they'd be healthier, but that skin that's folding over just folds over more because it loses its support.
I can't believe that's the same person. I mean, that's a really good recovery right there. You can't even see the scars or anything.
I've done some lipo on the back too also to help smooth that out.
All right, and finally, our last picture.
And the last picture kind of shows the front view of a tummy tuck. You can really see the shadows that run down on the sides. That's the outside edge of the rectus muscle.
Okay.
It shouldn't be that far out.
Oh.
So with the weight gain or with pregnancy, it gets stretched out. Afterwards, you can see those shadows are much closer together.
Yes.
And they're also smaller because we just have less stuff there.
So are you kind of making abs for this person right there?
She has abs, you just can see them now.
Oh.
And they get pulled off to the side with pregnancy and weight gain.
And I like that recovery. It's a very good recovery. And the belly button sits up nice. You know how the belly button has that sad look if the skin is
we don't like
sagging?
Horizontal belly buttons.
Yeah.
So youthful belly button is vertical with a little hooding in the top.
Beautiful. All right. We don't have a lot of time left on tummy tuck, but just recovery time again is not too bad, maybe about a week.
Week to 2.
All right. That was Kathy in Oakland. We're going to tell you how you can email Dr. Mealy and also ask him questions. But if you want to get in touch with the doctor, just call 925-943-6353, or you can check him out on the web at either drmealy.com or sanfranciscobreast.com. Now, Kathy from Oakland emailed in, so if you want to send Dr. Mealy an email question, just go to his website, drmealy.com or sanfranciscobreast.com, right?
Contact forms there. Just send it away. I'll see it.
All right, contact forms right there on the website, and you can send them. I like the emails because we get questions from real people, so I love that. So send your email questions for sure. All right, no more time on the tummy tuck. We're going to be right back with lots more on Body Beautiful. Next up, breast aug revision. We'll talk about that next. Stay tuned.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.